Hi everyone, so today we're going to do a PICC line dressing change. So before I go out to see the patient, I'm going to be looking at my orders, making sure I have what I need in my orders to be changing the dressing every 5 to 7 days per protocol for the VNAA procedure manuals. We're also going to be changing the extension tubings if that's what the patient is using, in addition to the claves. Those have to be changed with every dressing change or every time blood is drawn from the line. So I get to the patient's home, I've looked at all my orders, everything's good. Hi Mr. Smith, how are you doing today? I'm just going to be changing your dressing today. So you're obviously looking at the site. A lot of these patients have their little white mesh that they like to put over top to be able to kind of feed the extension tubing into that. It always is a good idea. The vendors do send a lot of newer supplies, so give them a fresh one. Those things get pretty dirty, so you can cut one and apply a new one with your dressing change as well. Just look through they usually get a huge bag from the vendor. Just look through that for these to change it out. You're going to be looking at the site. How does it look? Any signs of infection, redness, swelling, drainage? Is it pretty bloody or not? The other thing you want to be doing at every dressing change is arm circumference. We're going to be measuring 10 centimeters from the AC and taking the arm circumference, and that's in centimeters, and make sure that that is documented. That is something that we are tracking. I'm going to gather all my supplies. I have a central line dressing change kit. Always make sure you read what is actually in the kit, because some vendors will send the securement device like a stat lock and a bio patch. These will be separate, so you really want to make sure that once you open your field that you drop these into your field. Some suppliers have these things already in here, so you really want to be made aware of that. You want to pay attention to that. All right. You also want to make sure before you begin that the patient is in a comfortable position. Make sure that they're able to extend their arm nice and wide. Some of them are really in the middle, really close to the inner brachial, so it can get a little tricky. You might need to use a pillow or some positioning so they can really extend it all the way out, and also that you're in a good spot to be doing this too. So I'm going to be putting on some good hand hygiene first, putting on my clean gloves, and I'm going to start removing this. So I'm going to start just kind of going all around first. Okay. And then when you're taking this off, you want to be taking it off in a way where you're pulling it away from the insertion site so that to not cause any migration. That's why when you put the bio patch on too, you want your slit down, so that's an easy pull off like that. Get rid of this. I'm going to also be changing the stat lock. This does not stay. You can use a little bit of tape to help secure it so that it doesn't migrate out, like just a little bit. Just far enough away so that you'll be able to clean your site and sterilize it fairly well, but just enough so that your line will stay in line like that. So I'm going to remove my stat lock. I usually like to undo the tape first, just being very careful. And then you're undoing your wings. The wings of these stat locks are a little easier to manipulate if you grab them from below. There's a bit more of a lip down below. Looks that. And then I've already kind of undone my tape. And this is all with clean gloves. And get rid of that, and now I'm ready to go. Before you even start this too, you want to make sure the patient is looking away or they are agreeing to wearing a mask. All right, so I'm cleaning my hands again. Now I'm going to start my sterile procedure. I'm going to open up my kit. And here's my mask. Some kits have 2 masks for yourself and the patient. He might just want to look away, or he can use a mask as well. I'm going to take out my gloves. So I'm going to drop what I need into my kit. I know that I don't have a stat lock, so I'm going to put that in there. This is my bio patch. I'm also going to drop that. It allows me. So I make sure I'm all set. Patient is set. I have my gloves. All right. So I'm doing some hand hygiene, my hand sanitizer. I'm all set. I'm nice and sterile. So you can use this as a kind of a pseudo semi field. It kind of helps extend a more clean and sterile field if you do need a bit more room. Some people like to put it under the patient's arm. It can be on their lap, on a table. Just, it gives you a little bit more working space. Although I do recommend trying to keep your sterile field within your kit as much as possible. So the first thing I'm going to do is clean. The number one thing to use for cleaning is the ChlorPrep. You would use that, the one you click, make sure it's nice and soaked. You would rub that for 30 seconds, back and forth motion all over the area that will be under the dressing. If you do not have ChlorPrep, the second best thing to use is betadine over alcohol. So you would use that. There's usually three swab sticks in that. Open it. You start at the center and you work your way out in a circular motion. You do that 3 times with the 3 different sticks, and you allow it to fully dry. Betadine does take a little longer to dry. It might take up to 2 minutes, but it is very important to let it dry to make sure you have a good adhesive dressing. I will say too, in terms of drying, with the ChlorPrep, it does dry sooner, but if you don't let it dry fully, not only will you not have a good adhesive dressing, but that can also cause skin rash and some irritation. So if you're seeing that, it might be because you're not letting the ChlorPrep dry thoroughly. So my site is nice and dry. I want to look at my external length because that's something we're going to be documenting. And I had my little measuring tape here. Again, that's going to be in centimeters. So I'm about 1.5. So I don't need this anymore. I'm going to make a mental note of that. I'm going to be applying my new stat lock. As you're cleaning too, if you need to, you can always, to be able to get under your PICC, there's a few different pieces of gauze in here. You can always use a piece of gauze to kind of lift without, you know, pulling out, of course, but just lifting slightly to be able to get underneath there and giving everything a nice clean. And then you would obviously be disposing of that. So I'm doing this first. You want to apply the clips before the sticky part because you don't want to press hard on the patient. So when I'm doing this, I'm pressing behind my index finger. Then I'm pulling the wings to secure it. The next step is the bio patch. You want to have the writing on top and the slit down. It does not have to feed under the catheter, just plop it right on top is fine. And then I'm going to put my Tegaderm. And then I'm going to take this little piece. I'm going to make sure I am dating and initialing the date because the dressing does need to be changed every 5 to 7 days. You want to make note of that in the chart too so that the next nurse is aware and knows when it's due. Sometimes making a note in the non-clinical note so it's not something that is missed, changing this every 5 to 7 days. So you're also going to document making sure that you did your arm circumference, what your external length was, any signs of infection, how the site looked. We are changing the tubing, like we said, tubing and the clave. Make sure you are priming that with saline before you are applying to the patient, of course. Using sash, whatever reason the patient might have that. You'll have your flushes at the home. Making sure you're dating it and how the procedure was tolerated by the patient. And one thing too you want to be teaching them is they all come home with these clamps actually given to them by the vendors in the mail. So you want to be teaching that if they're noticing any cracks, any drainage, any leaking from the catheter itself, this is important. You want to be clamping as far up as possible to them. And then they need to either call us or go to the emergency room. Sometimes it's just the external tubing, extension tubing that can easily be changed. If there's an issue with the main PICC line, they do need to go get that checked out. So it's important to teach them to have this nearby and how to use it. I just want to mention in brief as well, you're probably seeing some new products coming out in the home. If there's ever anything that is new you haven't seen before, please contact Tanya or I. And we can provide you with more education. Some of them that we are seeing, and you probably have seen these now, is this one. For this securement device, it's being sent instead of the stat lock. And this is mostly being sent by Option Care. And this is what it looks like. And we'll give you a chance to look at these a bit more in depth and actually play with them and get a good feel for how to apply them. But basically it's not the stat lock, and it's just feeding the catheter under a clip and feeding over a little piece of tape. So we'll be having these, you'll be looking at these. Another one that is just starting to come out is patients who are having PICC lines and midlines inserted at Exeter Hospital or being sent home with these. And the main thing about these is that there's this little gooey patch that goes right over the insertion site of the PICC line. These are still changed every 5 to 7 days, but this has shown to significantly decrease central line infections, and that's why they are now starting to send them home with these. I am told, but we'll have to confirm with the vendor, that if you see a patient with one of these coming home, you can call them and have them send us additional dressings like this to continue this type of therapy with the patient. So we will also be reviewing these with you guys about specifically how to remove them, because that's the biggest, trickiest part, is that you do not want to cause pulling out of the catheter, any extended migration, significant amount, so that it's out of place. You end up using just a little bit of saline to take away the adhesive piece of the stickiness when removing it. But again, it's something you might start seeing. Reach out to us, but we'll hopefully be reviewing that as well. So I'm going to jump into the port. So we often call it portacath, people call it VAD, which is just a vascular access device, whatever you want to call it, your port, your VAD. So currently it is accessed. I'm going to be de-accessing it. Make sure you have sharps container. So a patient should have that at their home. I'm going to have my sterile kit, because I'm actually going to swap out the needle and have it ready to insert a new one. So I'm cleaning my hands. I'm putting on clean gloves. I've confirmed with my order. We're all in line with the current therapy, whether it's hydration, a medication. This needle needs to be changed. Needle access does need to be changed every 7 days. So I'm going to take this off first. And what can be tricky with ports is you never really know what kind of needle the vendor is going to be sending. It does have to be a Hubbard needle, but they might look a little different, again, depending on the vendor. So I have my gloves on, obviously, my clean gloves. So I'm gonna have a little gauze and just some tape or Tegaderm ready to put on afterwards. So the way these work, you've got the little flap here that goes all the way up. I grab my 2 wings and I should be able to just pull it out and slide it into that flap. Like that, so that it ends up being that the whole needle is now in here. Okay, so I'm now disposing this into my sharps container. I am now going to insert a new needle. When you're inserting, you want to make sure you're being consistent and paying attention to the needle size. Is it really sticking up too much? So this yellow one that I took out is a 20 gauge 3/4 inch Hubbard needle. I'm going to be inserting now a 22 gauge. So in part of your documentation, you want to document what size needle that you are accessing the port with. The tricky thing too is that they don't always send you sterile needles, sterile saline, sorry. So the saline inside here is sterile, but the syringe itself is not. So you really have to be careful with maintaining your sterility. The trick with these when you get your package like this, you want to feed the tip of this little extension tubing that's already connected to the needle. You want to feed it to the package where there's a slit. And I'll show you how you would try to keep it all as sterile as much as possible. So I'm opening this. I have my nice clean gloves on. I'm going to be applying a new clave. So this is still sterile. I'm flushing that through. So this is ready to go. So I've brought this tip all the way here. I can open this. And that's still sterile. So I'm holding the tip with the package so that this is still sterile. I'm taking the top off like so. I can connect this, prime my needle, and now this is at least still all sterile. I'm going to turn it like this, open it gently, so there's my needle ready to go. This is all still sterile, this is not, but at least now my needle is primed and I'm ready to pick it up once I'm sterile. I'm going to take off my gloves, clean my hands. Now I'm ready to get sterile with my kits. So make sure the patient's in a comfortable position. Sometimes accessing a port is the best or easiest done when someone is laying down. Sometimes it's okay if they're sitting. If they're sitting comfortably, they might need to extend their chest a little bit. You might actually need to get on your knees to be able, if they're sitting, to be able to access. The key thing is to get a good feel first. Really feel where your 3 dots might be, if that's the type of PICC the patient has, so that you have a good idea where to go and you have a good feel first. Okay, I know where to go. I feel confident. Wash my hands. I'm going to open my field now. And I'm taking out, again, the patient might want to wear a mask or look the other way. I can use this to help create a little bit larger working area. Let's say this was already in here. So I'm ready to get sterile. I'm going to put my sterile gloves on. Okay. So once again, I'm going to give all this a nice good clean. I want to use ChlorPrep as my first choice. Back and forth motion, rubbing back and forth. 30 seconds. If I don't have that option, you're using betadine. If it's there, you're allowing it to fully dry. Now I'm ready to insert my needle. So I'm still sterile. My wings are this way. I want to actually use my wings to insert. So I'm going to fold them back like that. Get a good grip on them here. So I'm actually going to come down. The key thing with accessing these is that you want to do so perpendicularly at 90 degrees. I'm going to take the little cap off. With my other hand, I'm going to get a good grip of the port using my thumb and finger. And I'm going to go straight in and commit, all right, at 90 degrees. Okay, so I'm in. You will feel the end of the septum when you put the needle all the way in. So now I want to give it just maybe a couple cc's flush first, and then you want to pull back to see if you have blood return. I do, I'm good. And sometimes they can actually taste the saline. They'll let you know. I'm going to extend my wings. I'm going to bring that down like that. And it's flushing well, no resistance. They're tasting it. I checked for my blood return. Now I'm putting on my Tegaderm. And with him, it's a little tough, but you do want to be careful of the nipple. That can be kind of sensitive there. Okay. So the same thing with these, you want to be then labeling it with date, time, your initials, and really indicate the needle size on this. If they end up having to go to the emergency room for whatever reason, it's always good for the team there to see what size you used to access and when it was accessed. So just a little addition for the port on that tab is to put the needle size. So there you go. And then in your documentation, you're documenting that you did this using sterile technique, that what needle size and gauge that you used, and how it was tolerated by the patient, and that you got positive blood return. And also want to keep track of when it's due every 7 days, depending on what type of therapy. So you also want to remember you're checking your orders for flushes. Some of them are not using heparin, most of them do, the vascular access devices. So with the port, obviously once you've accessed, you've given it a good 10 cc flush, you're always using that push pause, the same as for the PICC. And then you're using your heparin flush afterwards, and then the green cap. So always don't forget that piece. So the same for the PICC. You're going to be flushing it. When you do your dressing change and changing your extension tubing and all that, you do want to check for blood return and document that you have or have not obtained that. You might have them extend their arm, cough, deep breathe to try to get that blood return. If there's not, there might be a little fibrin sheath at the end of the PICC that might need to be looked into a bit more. They might need cath flow. So that's a little bit of problem solving there. You can always reach out to me or Tani if you guys need some help. But with this too, always make sure you're using push pause, and that you're ending with your heparin flush and then the green cap. So just keep in mind your sash, your saline, your antibiotic, saline, and then your heparin. All right, thank you.